Hi everyone. Today I want to talk to you about asthma and why we need to take our inhalers. So it's important for us to understand chronic asthma symptoms. Cough or wheeze more than twice a week, needing albuterol inhaler more than twice a week, nighttime cough at least once a month, difficulty sleeping due to cough, but you don't always have to have cough. There could be feeling of chest tightness, difficulty breathing, difficulty playing outside for kids. So here we have a picture of what a normal airway looks like, what normal lungs look like. So here we have the normal mucus inside the normal lining of the bronchiole, and here we have an asthmatic lung, which has excess mucus. So on the left, we have the happy lungs. That's where there's no coughing, no wheezing, kids playing outside. And then on the right, that's where we have the symptoms of cough, wheeze, difficulty breathing. So looking inside that bronchiole, that's what I want to kind of focus on here, is that inside this airway, the normal thin lining has a normal amount of mucus. And there's a nice opening here, right here in the middle. But in an asthmatic airway, there can be airway constriction due to inflammation. A lot of this buildup here inside what used to be that thin lining, it has gotten swollen. And so there's less space for the air to go through. That's why there's that chronic cough. So the rescue inhaler will help to relax the smooth muscle and open up the airway, but it does not help with that chronic inflammation. So it does not help right in here. And what really helps is a controller, a daily inhaler with a very small dose of steroid that helps to reduce this inflammation. If we don't do that, what I wanted to highlight here is that that inflammation, it can cause a little hardening of the airway. Even if there's no symptoms, in between symptoms, it's kind of lurking there and we can't see it. The only way that we know is with recurrent episodes of cough. So it's the pattern that we recognize. And if we recognize that pattern, we can really help so that we can take the medication that we're prescribed so that we can get rid of this little hardening that can happen. Because over time, if there's hardening within the airways, it's pretty much like any other condition, really. If there's a hardening, whether it's an arterial or if it's, let's say, your hose, if there's hardening here inside that lining, it causes stiffening. And over time, you can't breathe as well and can lead to persistent symptoms even into adulthood. So early identification can help so that we can breathe well because we need oxygen to flow through. We need the oxygen to flow through easily. I hope that helps. Thank you.